I would like to start by thanking my honourable friend, the member for Brent Central, for securing this important debate. Without doubt, the nation needs a full independent public inquiry into the government's handling of the COVID crisis. But one area in particular that demands scrutiny is this government's handling of the effects of COVID-19 on the Black, Asian and minority ethnic communities. Why ministers have ignored the evidence, dragged their feet and almost certainly contributed to a situation where people from BAME communities have been disproportionately ravaged by this terrible disease. Mr Deputy Speaker, for me, this is personal. I have lost loved ones to COVID. Jagir Kaur, my lovely grandmother, our family matriarch, from whom I learnt so much, but whose coffin I wasn't even able to carry on my shoulder. Satnam Singh Dhesi, my fun-loving Slough taxi driver uncle, taken away from us way too early, and then I had to endure the indignity of watching his funeral online via Zoom. Hemraj Jamal, my brother-in-law's father, who somehow contracted COVID in a Slough care home, and inexcusably none of us were there to hold his hand when he breathed his last. May they all rest in peace, and may we be forgiven for not being there. Because families cannot attend bedsides, and because the usual rituals and rites of funerals are disrupted, it makes loss even harder and grief even harsher. And there are tens of thousands of people suffering bereavement. Back in April, Mr Deputy Speaker, we saw BAME people being disproportionately affected by COVID-19 as data came in from emergency admissions to hospital. That's more than 3 months ago. On 22nd of May, King's College London research showed that patients from BAME groups admitted to hospital with COVID-19 are on average a decade younger than white patients. In May, the ONS reported Black people were more than 4 times more likely to die from COVID-19 than their white counterparts. Bangladeshi and Pakistani people were more than 1.5 times more likely to die from COVID-19, and similar situation for people from with an Indian heritage. And that was published more than a month ago. And of course, ministers had a wealth of evidence from BAME organisations presented to Public Health England, which ministers initially tried to delay, then cover up, and have released under pressure only this week. And this evidence tells us what we already knew. Ethnic inequalities in health and well-being in the UK existed before COVID-19, and the pandemic has made these disparities more apparent and undoubtedly exacerbated them. Why is this? Well, one major reason is racism. And this racism, unfortunately, is infected within our lovely NHS itself. Figures released, Mr Deputy Speaker, last week by the NHS Confederation show the number of ethnic minority chairs and non-executive directors of NHS trusts in England has almost halved from 15% in 2010 to a mere 8% in 2018. And quoted in the Eastern Eye newspaper, Dr Ramesh Mehta, president of the British Association of Physicians of Indian Origin, said this was down to, and I quote, rampant discrimination and a club culture within the NHS professions. Mr Deputy Speaker, representation matters, and the dismally low number of executive directors of NHS trusts is inexcusable. If BAME doctors and nurses are good enough to die on the front line, surely they are good enough to lead. While I'm proud to be a part of the most diverse party and the most diverse parliament ever, the lack of leadership positions in most key industries is shocking, including the all-important finance sector, where the majority of FTSE companies still have all-white boards. So rather than just tweeting about Black Lives Matter, those companies need to take a long, hard look at themselves to judge whether they are indeed a part of the change that they proclaim to be. Mr Deputy Speaker, diversity is crucial because it brings in people with fresh perspectives and different priorities, thereby enhancing and improving the overall performance for all of us. And perhaps a minister can comment on how she intends to tackle the racial discrimination within the NHS. It took until June the 16th for Public Health England to publish its 7-point plan. But surely this should have been done from the very start. And we don't just want to be carrying on collating data. Of course, I pay tribute to the frontline NHS staff across my Slough constituency, including at Wexham Park Hospital, and they undoubtedly they face incredible challenges and risks. But the British Medical Association reports that 90% of doctors who have died were from BAME backgrounds, and 60% of the NHS staff who have died have been from BAME background. These are absolutely staggering statistics, and they should make us all realise that something is very, very wrong. And in conclusion, given the lack of time, I would like to ask the Minister whether she can reflect on the plans to commemorate all of those who have lost their lives with a focal point of remembrance, and that we will learn the lessons. But more than anything, I hope that the Minister can allay my concerns, because I would like to tell her that Black Lives Matter and deeds, not words, is what is now that we demand. Thank you very much, Mr. Deputy.
Thank you, Mr.